Welcome to HealthCast, the heartbeat of health IT. I'm Alexander Bolova, production lead at GovCIO Media and Research. With me today is staff writer researcher Sylvia Oakland. Hi, Sylvia.
Hey, Alex. It's good to be back.
You had the opportunity to chat with Dr. John Balbus, Climate Change and Health Equity Director at HHS. How'd it go?
It was probably one of my favorite conversations that I've had so far. We talked about a lot of interesting things and, the intersection of health, technology, the intersection of climate change and health equity. You would not believe how much those things cross and interact with one another. And I think we're starting to see that now as everyone is facing really high temperatures, record temperatures, facing record numbers of storms and everything. And this is exactly what Dr. Balbus is trying to combat. So by using geographic information systems, or GIS, they're able to make predictions and forecast about what is happening in the climate. And an example of this that he talked about was predicting what summers would essentially look like and how you could predict where the heat pockets in cities or in counties were going to be. And from there, you could help people ensure that the cooling centers are fully staffed or fully equipped with the equipment that they need, that health professionals are on the ready and that they know, the week of July 12th is going to be really warm. We need to make sure that we have people on site and ready to go. He's had a long career in public health, and we chatted about that as well, going through his background. But it was truly incredible to talk about the climate-related hazards and the importance of, resiliency and how this technology, this GIS, can truly be helpful.
Yeah, it really is remarkable how technology is being used to create these predictive forecasts. But I'm wondering, Dr. John Balbus is director of both climate change and health equity. How does this forecasting tie into his mission of promoting health equity?
Of course. I think the biggest thing is this climate and health outlook that has been created. So this climate and health outlook is, again, kind of that prediction. It started off as a newsletter and started off just kind of, here's what's going to be happening over the next 30, 60, 90 days. And it's grown. And so it helps people essentially stay prepared for these emergencies. Think of intense flooding, intense storms, even when there were the wildfires happening in California. So essentially, this is going to help with health equity because people who are low income or who may be reliant on medical machines within their own homes, these at-home medical devices, they will be able to know this information in advance and then be able to prepare for whatever emergency may be. And emergency services within the area may also be able to reach out to them before these incidents happen, ensuring that less people are injured and hopefully less people are killed and affected by these natural disasters that are happening because of climate change. So there's a lot of great information on HHS's website, hhs.gov, on their blog, just looking at a couple of the blog posts that he's written and been interviewed in, really talking about how these things all really intersect and how technology may just be the answer to it.
This is all so fascinating to hear about, and I think we shouldn't keep our listeners waiting. Let's take a listen to your conversation.
Hello, everyone. Thank you so much for joining us. I'm here with Dr. John Balbus. This is Sylvia Oakland with GovCIO Media and Research. Thank you so much for joining me, John.
Very happy to be here today with you, Sylvia.
Let's jump right into things. And I wanted to talk a little bit about your background and how you got into your current position.
Sure. So my background is that I'm a physician. I'm trained in internal medicine and occupational and environmental medicine, and very really early in my career, actually, while I was still doing my training in occupational medicine, I became aware of what was happening with climate change and health and the need to do something about it. And this is 30 years ago. And I was one of the early people working on how do we assess the risks to human health from climate change. And so that has been my career ever since. I started in academia, George Washington University. I spent some time with the Environmental Defense Fund working on science policy there. And then for about 15 years now, I've been in the federal government. I came in to support the director of the National Institute of Environmental Health Sciences at NIH, helping to provide subject matter expertise in climate change and health. And I've served as the HHS, it's called a principal. It's the member of the subcommittee on global change research that oversees the U.S. Global Change Research Program. So I've had that role for 15 years now, and for a dozen years, helped to lead a working group on climate change and health. So when President Biden created or called for HHS to create the Office of Climate Change and Health Equity, I had been working on climate change and health equity for a long time in the federal government, and I was asked to come over and to start up the office.
Thank you so much. You have such an extensive background, and I remember hearing about it at ESRI's GIS conference where we first met. And, hearing it, I was very impressed. So I wanted to talk a little bit about GIS and kind of how is your office using it, and how does it relate to the overall mission of your office?
Sure. There's a lot of reasons why GIS is just so important to the work we do. The first, fundamental principle is that while climate change is a global phenomena, the impacts and the solutions are hyperlocal, super, super local. And so, GIS is, you have to be able to have a way to integrate this information that comes in about temperature or about elevation or sea level rise or the forecast for storms, all of this physical data that comes in a geospatial format with people and with neighborhoods and with houses and with tree cover. And then, to the extent we can, with privacy, to then be able to also superimpose those, geospatial health data. Because we need to know where people are who either have illnesses that make them more vulnerable, or where people are who are at risk and having bad outcomes because of climate related threats.
For sure. So definitely your office is focusing on like the use of technology, but also people. And that's something that I've really been hearing a lot in these conversations about truly utilizing technology to its full potential. And that's understanding kind of the needs and wants of the general public that you're serving.
Absolutely. Some examples, where this comes into play is where the work that, that we're doing and is also just going on in the human services side. So, in so many cases, the reasons why people are at greater risk and, the ways to protect people don't have to do with drugs or medical treatments. It's really fundamental human services, poverty alleviation, financial supports, supports for improving housing and things like that. So it's really important for the agencies to be able to know, where is that intersection? Where are the neighborhoods that have, the greatest poverty rates, the energy insecurity, and also are in urban heat islands, or have a lot of impervious surfaces and not a lot of green cover, so they're going to really have some of the highest temperatures when the weather gets hot. That's just one example.
No, thank you. And I appreciate that you brought up the conversation of those heat spaces, because I wanted to talk a little bit more about the climate health outlook that you brought up at ESRI's conference, and kind of just talking about, where did the idea for this dashboard come from and kind of the evolution of it.
Sure. Well, it started out as kind of a newsletter, and the idea dates, for the federal government, for us in the government, dates back about 5 or 6 years. And I will say that in our efforts to really try to raise people's awareness about how climate change impacts health, we noted with interest. And I was working actually with folks in the Caribbean at the time. And, this was, again, about 6 years ago, 7 years ago, maybe. The Caribbean Public Health Association and the Caribbean states got together and they created, a Caribbean Climate Health Bulletin. So they started publishing a newsletter that looked at the 30 to 90 day forecasts. And this is what our Climate Health Outlook is doing. So, the Weather Service puts out a 48-hour forecast and a 7-day and a 14-day. But NOAA and the Climate Services and the National Weather Service also put out these, what's going to happen in the next 30 days or the next 90 days. And we thought that this would be a really, useful piece of information for people who are in emergency response or who are, trying emergency medicine, to just know, is this going to be a really, dry summer or a really hot summer? Are we going to have wildfires? Are we going to have floods? So we, again, the idea kind of came from the Caribbean Health Bulletin, and in our interagency working group, we wanted to be able to do this. We were looking both at how this 30, 90-day forecast could be used across all kinds of hazards, but also very specifically for vector-borne diseases, because vector-borne diseases are influenced by the climate, that happens a season or two before them, and of course, and what's going on in terms of rainfall and temperature at the time. The insects are very sensitive to that. So that's the genesis of it. That's a little bit of a long story, but that's the genesis of the Climate Health Outlook. When we were able to start up the office, one of the first things we wanted to do was to create this newsletter, was to create a place where we could bring together all of these 30 to 90-day forecasts for heat, for precipitation, for drought, for wildfire, the hurricane forecast that comes out, the pollen forecast that comes out, to put it in one place to explain to both the general public and to healthcare providers how, the climate and the variability and the increasing variability we're seeing plays out in terms of health impacts. So we created this, and then we thought, well, it would also be really important to be able to communicate about who is most at risk. And that's where this idea of GIS and people comes in again. So we created a database for our newsletter where we brought in over 50 different indicators of human health vulnerability. Everything, like I had said before, from demographics of, extremes of age and, children without health insurance, to energy insecurity, to, rates of diabetes. And so in our newsletter, we would profile, the counties, under warning for high temperatures or wildfires. And then we said, well, wouldn't it be great, because the newsletter is a PDF, it's 8 pages, you can't really drill down to the, over 2,000 counties. We said, wouldn't it be great if we could actually put this into an interactive portal? And that's really where the GIS power came in. So we were able to work with partners at the Agency for Strategic Preparedness and Response to post our Climate and Health Outlook portal, which gives partial information. We only have heat, wildfires, and drought on it at this time, but it's a map where that underlying database on who is vulnerable can be, when you scroll and you look at your county, you can see what warnings you're under and what's the profile of your county in terms of vulnerability.
Yeah. And so what has the local and state community response to this portal been like, from its starting point as that PDF, that newsletter, to what it is now?
One of the challenges of the federal government and one of the challenges of being in office that doesn't have congressional funding is that kind of outreach and feedback is sometimes difficult because of lack of resources. We have we have had feedback in settings like the ESRI conference or in conferences where we go and we talk about it, and the feedback that we get is always very, very positive. And at the same time, we're always getting feedback you know, we would let, it's great to be at the county level. We'd love to be at the zip code level, or we'd love to be at the census tract level or census block level. So there's always that issue of getting to higher spatial resolution. But overall, the feedback has been very, very positive that this is, just information you can't get in the same place anywhere else.
Definitely. And I mean, it sounds like, you've already made leaps and bounds in the sense of, again, going from a static PDF version to this now interactive platform. And so, looking to the future, where do you want to see the dashboard in 5 years from now, or even looking farther into the future, a little bit more long term in 10 years?
Yeah, there's two different directions that we're trying to go in. One direction is to take this information and to, try to incorporate it into the, the geospatial resources that are truly operational, that, that emergency responders and hospitals and health systems and public health departments go to when they're either planning, their public health emergency preparedness grants, or, when they're doing their real work, that it's not just a side thing in this office that, just got stood up, but it really gets embedded into the operational, you know, um, resources that are the go-to. So, at the ESRI conference, one example of that is the Empower database that ASPR, the Administration for Strategic Preparedness and Response, creates with Medicare and Medicaid data, that allows emergency responders to, highlight. It was built to highlight people who use durable medical equipment, but it also has a function for planning. It has a public-facing piece that allows you to get down to a very fine level to be able to do planning. So, we would want to make sure that, you know, that both the best indicators, the best, indicators for where people are at greatest risk get into that. And then ultimately that Empower, which, now has layers for, I think, I don't know all the timeframes, but short timeframes, 1 day, 2 day, 7 day timeframes that we layer in some of that data. So it's all kind of in one place. We're not creating multiple places. The second direction is to, have this work that we're doing, at the same time that, CDC is creating a lot of resources in its environmental public health tracking system, and FEMA has its risk, and, all the agencies, have their resources. What I want to be able to do is to have those resources be scalable, so that, a local jurisdiction can, and to tie it into longer term indicators. So right now, I'm talking about an operational use, for planning, at a particular point in time. But I would like to see, growing consensus and, research-based validation of this set of vulnerability factors that we've created, or we've pulled together for the outlook, become a part of indicators that we look at from, the city level to the national level for how well we're doing in terms of protecting people. So, as we are as we get more focused on adaptation, as we get more focused on building community resilience, we want, those indicators of vulnerability, or the flip side of that is indicators of resilience and strength, to be something that we can scale from, a local level, so a community can dig deep, but, we can also see a national view to see how offices like ours are doing in kind of addressing working with human services to address energy and security, working with Congress to be able to provide, the resources to address those vulnerability factors.
Yeah, so really working on like strengthening those partnerships and relationships is what I'm hearing is kind of a real central goal that you have for the future.
Absolutely. Well put. Our office, is meant to be a hub within HHS, and it is the health and the human services side. And so being able to optimize, work in partnership with, community health centers and primary care to be able to, address people one by one, and then, working on the human services and public health side to be able to work with community resilience and the housing and financial side, as well as, the immunization and, primary prevention side of health. That's the solution that we need for the climate crisis in this country is to, address those things that make people at greater risk.
Yeah. And you did talk about some of those risks of pollution and, all of these things that are coming out of the healthcare sector at the ESRI conference. And one thing that really stuck out to me was you mentioning that the healthcare sector is a large producer of some of those carbon emissions and everything. So I know that was one of your goals, to reduce the amount that they're putting out. So what does that goal currently look like, and kind of the initiatives that you're taking?
Yeah, absolutely. It's a really important point. The health sector, pretty much just by virtue of just how big it is and how much of an economic engine it is, ends up being a really significant contributor to greenhouse gas emissions and other kinds of pollution as part of the U.S. In the U.S., where the health sector is about 8.5% of the total U.S. greenhouse gas footprint, and globally, it's somewhere between 4 and 5%. Which makes it bigger than the airline industry, for example. It's significant, and since our primary mission is health, it's really incumbent on us as professionals and morally to do everything we can to minimize that. And so this is one of those areas where, in fact, Congress and the Biden administration have really made historic, transformative progress through things like the Inflation Reduction Act, which is liberating billions of dollars to invest in pollution reduction, in reducing greenhouse gas emissions, as well as community resilience. All of that is in the Inflation Reduction Act. So our office is really trying to seize upon this. We're right in the midst now of what we're calling a catalytic program, where we're doing very deep dives, trying to bring in health systems, especially safety net health systems, the community health centers, the rural hospitals, the urban hospitals, and really show them all the things they need to do, all the things they need to know in order to be able to access those funds to pay for things like solar energy and microgrids. And so there's a whole part of this about how do we power healthcare. This is a global issue. There's a tremendous amount of work being done for example, solarization of clinics in Africa so that they have reliable, resilient health systems. But it's equally pertinent in here. There's lots of systems that are, purchasing solar panels and battery backups. And, CMS issued a waiver about a year ago that allows those health systems to use solar microgrid and battery backup as their emergency power supply, so that it's both, the everyday and power. That was a big regulatory hurdle. So that's part of the solution space is cleaning up the energy consumption. There are other things that we're doing. Other parts of the greenhouse gas emissions from the healthcare sector relate to things like anesthetic gases. And so we're working with the federal health systems to reduce the wasting, and the waste emissions from anesthesia and anesthetic gases, because they're very, very potent greenhouse gases. And then lastly, the majority of the emissions are, again, because it's such a big economic engine, are associated with supply chains. So it's the embedded carbon dioxide from the production and transportation and distribution of all the medical supplies and all the pharmaceuticals and, to some degree, the medical devices. So, we're trying to mobilize the whole sector with a commitment campaign. So for 2 years now, we've been running in partnership with the White House, a health sector climate commitment where private sector entities have pledged to reduce their greenhouse gases and make themselves and their communities more resilient. That's kind of an organizing principle. And then, we are not just asking for the commitment, but we're helping, all of those organizations to be able to access the financial supports and incentives to be able to actually make the investments and do the work.
Yeah, and you mentioned that, in Africa, they're using those solar panels and starting to just kind of see those results. Are there any examples you can provide here in the US that come to the top of your head of how hospitals or clinics are starting to kind of mobilize and take from this?
There are many around the country, and even in places you wouldn't think about being big solar centers, like the Boston Medical Center is a national leader. We featured them in our events in creating solar fields, and University of Pittsburgh as well. And in both of these cases, the Children's National Medical Center has a research campus. In all three of these cases, I think one of the things that's really important is they're not just powering the hospital or the clinic or the laboratory, but they're also creating a community resource and sharing that energy, the reliable, low-cost solar energy with the surrounding communities. And then there's examples out west. Kaiser Permanente was one of the first and has, extensive solar installations, and they're getting to a place where, even though they're a very big system, that their reductions and they're on pace. I don't have the figure at the top of my head, but to be close to net zero before 2050, like the overall economy commitment. There's a health system called Valley Children's also, which has a very extensive solar array. So many are there. A very exciting development is that this is also going to the community health centers. So the National Association of Community Health Centers just received a big grant from the Department of Energy to do this kind of work for some 175 different community health centers in the southeastern part of the country. And of course, the community health centers are embedded in their communities. So very often they provide a kind of whether it's a resilience hub where people can come, in the setting of a power outage, because they will have their own self-contained, reliable power supply, and they can go there to charge phones, et cetera. Or they actually, frankly, share the energy generated with the surrounding community.
That's wonderful to hear, especially as, I think about my hometown and some of the natural disasters that are happening there. In Iowa, in Cedar Rapids, the derecho was a really big issue. And thinking back earlier to that, the mass flooding that we continue to get. So I really appreciate that, so many people are taking action on this. But I just want to pivot on one thing, and that was, I think one thing that people might be concerned about is that data security, that privacy that you kind of mentioned earlier with using some of this data. So how are you and your office ensuring that the public's data is secure and that, those privacy issues are being handled?
Yeah, that's a very important question. Let me first say that, our office, does not collect or generate or store health data ourselves. So, when we look at something like the Climate and Health Outlook, we're really working with publicly available data 100%. So we do not have sensitive data in our tools at this point. And the health data is we use in ways that's just fully compliant with HIPAA. And when we are for example, accessing one of we've helped to create a data source related to heat using emergency medical services activation data from the National Highway Transportation Safety Administration called Heat Tracker. But we are only getting those data and using them in a way that's very aggregated, so there are absolutely no personal identifying information within there. So I just want to reassure that the data that we are using are not data that are sensitive at the individual level.
I think people will be very happy to hear that. Like I said, especially as conversations around data privacy and data security are really becoming kind of the focal point of tech and everything that's happening.
Absolutely.
So thank you so much for speaking with me today. Do you have anything else that you would like to add, or any other, information that you would like to provide our listeners with today?
The only thing I'll say is, and this is where, to some degree, the partnership with ESRI comes in, and ESRI's role with the various federal agencies. We really are. I won't necessarily say at an inflection point, but we're in a very different place now than we were 10 years ago. For example, when we started thinking about the climate health outlook, in that there are a lot of different resources out there now. And so, I think one of the real important things in the future, and the federal government is in the midst of standing up, kind of new coordination mechanisms among the people who are creating these climate services, so that both the federal agencies, but also the health systems and your listeners and the general public don't have, multiple competing resources, that we are building our way to consensus. Now that we have, a very robust research initiative at NIH, for example, we can build the evidence base, to have stronger, validation, stronger consensus building processes around what are the most important vulnerability indicators, what are the health outcomes that are most sensitive to climate outcomes, and start to build, really useful, more unified and less fragmented information systems for doing what we have to do, which is protecting the health of people in this country in the face of climate change.
Yes, thank you so much, John. I really appreciated our conversation today, and I look forward to hopefully being able to further this and talk about some of those goals and some of those community partnerships that we mentioned earlier. So thank you again so much for joining me here on HealthCast.
Thank you again, Sylvia. It was a lot of fun.
Thank you, Sylvia. That was a terrific chat with Dr. John Balbus. Before we let our listeners go, are there any last highlights or takeaways that you want to leave them with?
I would definitely say that this episode is one that I hope people get a little interactive with. Check out the Health and Climate Outlook, again, hhs.gov. You can learn some really fascinating information and kind of zoom in on that county, that local level, and kind of see the information that has been there for your county, for yourself. And you can see, if these predictions are looking correct from your point of view, and seeing if that's reflecting what you're experiencing in your community. And I would encourage people to think about how this technology could really impact their own community as well.
Thank you so much for this conversation, Sylvia. And again, listeners, if you're curious, you can check out the URL in our show description. With that, that's all for today's HealthCast. We'll be back next week with a brand new podcast in our GovCIO Media and Research podcast feed. But in the meantime, if you like what you heard, make sure you leave a review and a 5-star rating on the podcast platform of your choice. Subscribe as well, and hey, tell a friend. We always appreciate growing our audience. I'm Alexander Bolova.
And I'm Sylvia Oakland.
Thank you for listening. HealthCast, along with GovCast and Cybercast, is a production of GovCIO Media and Research. To explore our content, visit our website, govciomedia.com. Keep an eye out for new episodes every Tuesday. And if you like what you heard, leave us a review on the podcast platform of your choice. Have a topic you want us to discuss? Contact us at newsletter@govcio.com.